I am Dr. Raghubir Banerjee. I am a practicing dermatologist, practicing in Wizderm clinic, Jodhpur Park also. The next topic I would like to discuss is psoriasis. Psoriasis, there's a lot of myths regarding psoriasis. Patients have to be demystified regarding what the disease is. They have to understand the disease because the layman is afraid of eczema, afraid of psoriasis. So these conditions, psoriasis especially, and you can call it an autoimmune condition, and where the cells produced get heaved up, there are scaly plaques, some are itching and redness occurs, especially on the extensor of the extremities. It's a chronic condition. It may take a long time to get it under control. And there are different varieties of psoriasis. It is not a contagious condition. This is something which the patient has to understand. Most of the time they feel that they may pass on the disease to somebody else. There is a hereditary tendency, of course, but it is not a contagious condition per se, and the patient with psoriasis has to be properly counseled regarding the disease process, that what is psoriasis, what to expect, what outcome to expect, and what are the therapeutic armamentarium we can offer the patient for control of the disease condition. Well, psoriasis varies. All psoriasis are not extensive. There can be localized patches of psoriasis, then can be generalized psoriasis vulgaris, where patches are there all over the body. There can be an erythrodermic variety where the whole skin, or more than 90% of the skin, is involved. There can be a variety called pustular psoriasis, where the lesions tend to pustulate. And of course, do not forget, psoriasis can affect the nail, psoriasis can affect the joint. Sometimes we get arthropathy associated with psoriasis. Coming to why do we get psoriasis? There is a genetic theory, there are environmental factors, heredofamilial factors, a lot of stress, the lifestyle modifications. So it is not, we can not pinpoint that this is one condition or this is one cause that causes psoriasis. So a lot of factors interplay in the development of the disease, starting from drugs, starting from lifestyle, starting from stress factors, infective factors, and a lot of things. They act together in the development of the disease, though basically it is found to be an autoimmune condition where the heredofamilial factor also comes into play. So according to the type of psoriasis, the treatment protocol or the treatment has to be tailor-made, and the treatment varies. Which modality will work for which condition? So we have a lot of topical steroids, topical vitamin D3 analogs. We can use phototherapy. A lot of immunosuppressive drugs and biologics are there to treat psoriasis very effectively. Don't search for a cure, but it is a condition that can be well controlled and the person can lead a near normal life. Well, coming to treatment of psoriasis, as I've already mentioned, it will vary according to the disease process. For localized psoriasis, we can control with just topical therapy, moisturizers, topical steroids, topical D3 analogs. For more generalized variety, we go in for the immunosuppressive agents like methotrexate. If the psoriasis is very acute stage, we'll think about drugs like cyclosporine. And of course, as I've already mentioned, phototherapy in the long run has a major role. The PUVA therapy has a major role in controlling psoriasis. If there is pustulation, we will think about crisis buster drugs like cyclosporine, acitretin, and so on. So according to the type of psoriasis, the treatment will vary, and we have to take a call that which drug will be effective for this subcategory of psoriasis patient.